Hernia just means hole. It just means that there's a hole there. In kids, it's a little bit different than adults. A hernia in kids, especially an inguinal hernia, is something they were born with. It may not present until later, but it's something that was there usually since birth. 5% of all term babies born at term gestation will have an inguinal hernia, and that number is higher in premature babies. The most common hernia is an inguinal or a groin hernia. We also see some umbilical or belly button hernias. Those are the two most common types. An umbilical hernia, the symptom would be that the skin protrudes. There's a bulge there where the navel is. Those can be associated with discomfort. Most of the time it's just a cosmetic issue. It's the way it looks. The other type of hernia that is very common is an inguinal or a groin hernia. And those present with a bulge in the groin. Those can be associated with pain. In little boys, that bulge will descend down towards the scrotum. In little girls, you'll see a bulge there in the groin. In adults, it's common to use a mesh component, basically a synthetic product that will keep the hernia from coming back. In kids, we don't use mesh. It's usually tying off the hernia sac, the balloon of tissue that descends down into the groin space. We usually tie that off in a child, and that's curative. The routine run-of-the-mill umbilical or belly button hernia that's just not causing any pain symptoms, but more or less is just an outpouching, we'll watch those. 85 to 90% of those will close by kindergarten. Sometimes they're really large, and we do repair those, fairly early in life. In general, after surgery, kids have a very quick recovery. They're resilient. In kids, we use absorbable stitches. We do as much as we can to not have to take stitches out, or that our bandaging is very low maintenance. So kids after surgery for a routine inguinal hernia repair, they'll more or less be back to themselves within a couple days. Usually say a couple weeks, really limit PE type activities as much as you can in those kids, and then 4 weeks for no contact sports. But it's a quick recovery.